Okay, another ugly side of nursing video. Last one I did was poop, and it's a little more serious than poop, but probably just as gross to people, or more so, depending on the person. Um, you know, I find most people just never get a tolerance level for poop. They're just, that's whatever tolerance level they have. That's it. That's the level they hit. Whether it's a lot or a little, whatever, it doesn't get better. Um, Gore though, blood and gore, real, you know, body damage stuff. Whether it's an injury or surgery or what have you, rot or infestations, whatever. You can develop a tolerance level for. I've got to develop a very good tolerance. I've always had a pretty good tolerance level. For now, it's like, other than the smell of it. The smell of it sometimes can bother me, depending on the level of decay, I guess, or other odors that develop from maybe the body's defenses of it, or whatever, or maybe the creatures involved or whatever. I mean, depends. That sometimes still catches me off guard. It's like, oof. That's something though I find, and I think most people, you become deadened to. Like, it's just like you develop a callus, basically, mentally, or you can develop a resistance to better than poop. Poop is just like everybody just kind of reacts the same way, and either you accept or you don't. Gore, people become deadened to. It's kind of like soldiers and whatnot, and violence. You become a little deadened to it after you're so exposed. That's the thing with, like, what video games and stuff like that they squawk about. But and that's that's what would be the advice I give to you guys, if you're a little wary of that, is to expose yourself to that in videos or pictures or stuff like that. These days you have on the internet, so it's very easy to, and little by little, build up your tolerance to that. You are going to see stuff that's going to be frightening. I'm going to flat out say it. I don't say this stuff to frighten you guys off. I say this stuff to just prepare you guys. Again, it's my way of helping you guys expose yourselves to this field and not run away running. Go away. I mean, people say, I can't deal with that. I say, but then, later on, they deal with their kids' poop day and out. They're going to have to take care of their loved ones one day, your parents or whatever, and deal with it. You have to deal with it, and not be a nurse. I'm saying, like, everybody crosses those thresholds sooner or later. You pick up your dog's poop, or your cat's poop. It's going to happen. Hell, you prepare food. And that's the gore you're talking about. People, it looks like musculature and what have you. It is. And some people say, that's why I'm vegan, right? And I was like, okay, well, I'm a carnivore. I eat meat. So, sorry. Sorry to the poor animals and whatever, but, I need sustenance. But, gore and stuff is something you're going to see. You're not going to have to see it every day. But when you do wound care, it's going to be pretty frightening. I mean, I've seen wounds that I can almost stick my entire head into. I was like, it was like a shark bite, and I'm just sometimes flabbergasted that, I'm like, people can suffer the most incredible amount of damage and be fine. I mean, there's other damages that you could see, explosive damages and whatever, that they can't. I mean, they might be alive for a while, but they're gonna die very soon. But there are other damages that it's just amazing. I'm like, they live for years that way. It's incredible. I've had to help surgeons with wound care, and it's just like, oh my God, it's like a cavern. So, not to gross you guys out, I'm sorry to, it's shocking, and I encourage you guys to look at those pictures and imagery to kind of toughen you up for that, so that when you are encountered by it, that it doesn't scare you away from it, whether as a student or as a full RN. Okay? Good luck.